Hello, my name is Dr. Joseph Lawrence of the Broadview Spine and Health Center. I'd like to thank you for coming to visit our website today and give you some background on what spinal decompression therapy can do for you. Spinal decompression therapy has been very effective for a number of conditions which include sciatica, stenosis, back pain due to spinal degeneration, facet syndrome, or after post-surgical cases. It's been very effective for lower back pain, but as well for neck pain. In just a moment, I'll go over exactly how spinal decompression can help you. One of the most important things to realize when it comes to development of back pain is the fact that over time, the segmental muscles that holds the spine in place become weak. When they become weak, this allows these cushiony structures in between the vertebra or bones to break down. This breakdown process can either develop into herniation or bulges in the disc, or over time degeneration, all significant causes of back pain. Okay, what we'd like to look at is a model of the human spine to depict how the herniation or bulging the disc can occur. This model here shows us two vertebrae with a cushiony disc structure in between. And in this computer-generated model, what we're doing is we're looking on a top-down view. So what we have here is the posterior or back part of the spine. This is the spinous process, or that bumpy structure you feel when you run your hand down your spine. And this is actually the disc structure, which is made up of a cartilage-like tissue on the outside, which is firm tissue, and a gel-like material in the center called the nucleus pulposus. Next to that is the spinal cord and then the nerve roots which emanate from the spinal cord. Now what's important to understand is, over time when these segmental muscles around this area become weak, the spinal disc can begin to break down. And what happens is, as I show you here, is with this breakdown, there's small tears can develop in this outer cartilage ring of the spine. When those tears develop, this can allow this gel-like material to bulge, push, or sometimes escape, and putting pressure on the nerves that emanate from that area of the spine. Now this pressure can either cause pain in the leg called sciatica, or pain in the arms, which is called a radiculopathy, which is the same type of issue where pain radiates into the arm as it does into the leg. Now the key element to understand here is with spinal decompression therapy is the whole goal is to reduce or bring back that bulge back into the proper position over time, all without drugs or surgery, and painlessly allowing the disc to heal properly. Let's explain generally how spinal decompression therapy works. This is showing you a side view of the lower back here, where we have the vertebrae again with the discs in between here. And what this computer-generated model demonstrates is a bulging of a disc impinging upon a nerve that exits the spine here. Obviously a source of discomfort. Generally how spinal decompression therapy works is, over time, the application of a force to the spine will gradually draw the spine apart, therefore positioning the disc back into its normal position, ultimately taking pressure off of the nerve. When this pressure is reduced, that's the first sign one sees, is the absence of discomfort. But it's really important to understand that the number one question I get is that what would prevent this bulge from reoccurring again? And the answer to that is that the spinal disc needs time for scar tissue to occur in that area in order to heal, thus preventing that disc from rebulging. And secondly, and most importantly, is proper strengthening of the segmental muscles around this area to help stabilize the area so that it won't be a reoccurrence over time. Okay, back to our computer-generated model. A very important point that I want to review with you relates again to this process of disc damage and repair. So just to reiterate, as I'm showing you here, as the disc material breaks down and this gel-like center has a chance to press or exit the spine, with decompression therapy, as we can help to reposition and enliven the disc repair, one of the key elements to understand that's very, very rarely reported is that it takes approximately 300 to 500 days for adequate scar tissue to develop in this area, thus helping to recontain the disc material. That's why it's very, very important to understand that first the disc problem must be repaired, then you must address this segmental muscle strengthening around this area. Does that imply that an individual will be under care for that period of time? Not at all, but what it does imply is that if you are able to go through that period of time without significant re-injury, the probability of your long-term outlook is very good. Of course, one of the most common questions I get asked is, how long does one have to be under care for decompression therapy? Well, quite frankly, that's predicated on the results of your exam. Our examination procedure here is very unique insofar as the testing procedure can actually help you understand what the cause of the problem is, and therefore helps us to formulate a plan of action. Typically in our office, we like individuals to undergo a trial course of care. Why we do that is because the trial course of care will allow just enough time to see if we're going to have a positive outcome, and secondly, not be so long that if we're of course not on the right track for whatever reason, that we won't be wasting any time or money. If you qualify for care, a typical trial therapy takes 4 weeks to complete at a frequency of 3 sessions per week for a total of 12 treatments. The most important number we're looking for is 30% subjective and objective improvement. At the end of this trial, I'll perform a progress evaluation. I'll compare your original exam results to your progress evaluation results, and this will help us to determine if any further care is warranted, and of course, what exercise will help to confirm long-term results. So what will it take to get you the best results from spinal decompression therapy? Well, of the many points, first one is allowing yourself 4 weeks of uninterrupted care. It's really important that during the trial you have consistent care through an uninterrupted 4-week period. This is important because in order for us to reach that 30% subjective or objective minimum improvement point, this is key component. Number 2, following our recommendations as it relates to, for example, your work. If, for example, you're under lumbar decompression therapy and you're involved in heavy manual work that will put stress on your lower back, it's important to seek out some modified duties to allow the care to get its best improvement. Secondly, recreational activities. My philosophy is early active intervention, early active movement. However, some of your recreational activities might be contraindicated to your care, so that will have to be treated on a case-to-case basis. Finally, home care. For example, for our lumbar decompression patients, it's recommended that right after their care they go for a brisk walk, usually around the block of our clinic. This helps to really improve their improvement for their progress. Sometimes we'll also give some exercises, but it's really important to follow these points here to help you get the best from your care. Up to this point, we've been really focusing on decompression therapy. However, the treatment of your condition really is an integrated process. In our clinic, we of course rely on decompression therapy. However, the very unique approach for stabilizer muscle exercise strengthening involves what's known as active therapeutic movement. In addition, if the cases indicate, we may use some laser therapy as well as some natural anti-inflammatories. So the whole component of care is one of an integrated approach that's been proven to be very successful in our clinic. In order to determine if you qualify as a candidate for care, you first must undergo a consultation and an examination. Unfortunately, our form of care is not covered by OHIP. However, if you have third-party extended insurance, it may qualify under your chiropractic benefits. On behalf of my staff, I sincerely hope that we'll be able to help you return back to a normal lifestyle from the chronic pain you may be suffering.